was a good catch. Go, 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 go. That's a good catch. Go, go. That was a good catch.
And welcome. Hey, everybody, I'm the Dr. Bob Lee from 107.5 WBLS. Welcome to Inside Lincoln Hospital, the heart of the Bronx. And today, well, we're going to be talking with Dr. Debra Taubel. She's the Chief OBGYN Services at the NYC Health Hospitals, Lincoln. And we'll discuss what drew her to a career in healthcare and all the latest updates at Lincoln Hospital. Our conversation with Dr. Taubel will also focus on the women's health services provided at Lincoln, including the range of care options available for patients. I'm the Dr. Bob Lee, and this program is brought to you by Bronxnet's Media and Technology Studios and NYC Health Hospitals, Lincoln. Dr. Taubel, thank you for joining us. It's so wonderful to have you here because I heard you are a wealth of information. Is that true? Of course it is.
Yes, and thank you for having me. I really appreciate being here.
Oh, so tell us, to start it out, tell us a little bit about your background and what initially drew you to a career in healthcare.
Sure. I am a born, raised, educated, trained New York girl. Born in Brooklyn, raised in Queens, went to City College in Harlem, went to Hunter College in Manhattan, went to downstate for my medical degree in Brooklyn, and then trained as an intern and resident at St. Luke's Roosevelt, which is now Mount Sinai West in Manhattan.
Oh, yeah.
When I was growing up in high school and in college, we were always encouraged to volunteer, and I chose to volunteer initially at Bellevue Hospital. So I was in health and hospitals back in the 70s and 80s, and I loved it, and I saw how people could affect people's lives with good care. I saw how medicine was a combination of science and taking care of people, and I was good in science. And then I went to college, and at City College, right down the block is Harlem Hospital. So I used to walk down through St. Nicholas Park, up 135th Street, and go to Harlem and volunteer there. And the same thing, I saw amazing care being given to everybody who walked in. And I was like, this is a great career.
Yeah.
So I decided to go to medical school.
And you're a native New Yorker.
I am.
Yeah.
Through and through.
Beautiful, wonderful. Sounds like Lincoln offers a variety of women's health services. Can you tell us a little bit about the type of resources offered at Lincoln Hospital?
Yes. So I oversee women's health, and we take care of women in every stage of their life. Of course, we're OBGYNs, so we take care of prenatal patients and we deliver babies. And most people think of OBGYNs just doing that. That is not true. We take care of women for preventive care and primary care. We take care of problem visits. We take care of women who are going through mature women changes. We take care of problem visits if you have any questions there. So whatever you have, we can take care of it if you're a female.
And Lincoln is designated as a baby-friendly hospital by Baby Friendly USA.
That is correct.
Can you explain what that distinction represents?
We've been baby-friendly for a couple of years now. We were the first hospital in the Bronx to be baby-friendly. What that entails is all of our staff, our doctors, our nurses, our ancillary staff are committed to making sure that moms make the best choice about feeding their babies after delivery. Of course, breastfeeding is the best food and the best way to get your baby the nutrition it needs. However, there are some women who choose not to. So we make sure that whatever they choose, we support that and they get it done correctly to make sure the baby grows up and has a healthy life.
Yeah, and for expecting mothers that are told that their pregnancy is high risk, how do you make sure that the delivery team has the appropriate information and ability to assist the expecting mother?
So I'm gonna start off even before that. In our clinic, in the first floor of Lincoln, any patient can walk in any day, Monday through Saturday, and get a free confidential pregnancy test. If we see that you are pregnant and that test is positive, you will get an assessment right there and then that day, because we want to identify any high-risk conditions early on. The earlier we get it, the earlier we can treat you and make sure you have a healthy baby and an outcome. The goal is always healthy mom, healthy baby. So whatever we can do up front, we can do that. We have a subspecialist in maternal fetal medicine in the hospital 24/7. We also have pediatric care to take care of the newborn if the newborn needs any support immediately after delivery. We have a specialized high-risk OB clinic, and we have ultrasound and procedures done right there on the same floor as labor and delivery.
And how can you tell if someone is high risk?
Some of it the patient will tell you about. She will give you a history or say, I was high risk last time, which sets up the flags, and we know we can screen for things.
Yeah.
Sometimes it develops in the pregnancy. They had normal blood pressures before. During the pregnancy, they have high blood pressures. That would then be high risk.
High blood pressure, diabetes.
Diabetes, high blood pressure, things like lupus, any of those diseases would put you high risk.
Yeah.
Some of it has nothing to do with mom. She comes in, she's pregnant, and oh, she has twins. That makes her high risk. So there are so many different ways of identifying a high risk patient. But we do it and we get them to the right person and get the right screening and the right care.
How do you ensure that her wishes are followed? Like an expecting mother wants to have a natural birth or has a specific traditions in the family that she wants to follow.
Sure, we have many patients who express certain desires during pregnancy and during the delivery process. First is we want to make sure that the patient's wishes are respected as long as mom and baby are doing well and that the family is respected. We have various types of providers to provide the right care for the patient. Besides the high risk, we have midwives. We have 2 midwives on staff who not only take care of patients prenatally, they're on the labor and delivery floor, and they provide on-site childbirth classes, which helps for new moms who may be really apprehensive about going through labor or having an epidural or pushing the baby out. With that in mind, we always connect with our patients ahead of time. Once we get to like the 3rd trimester, we talk to them about, do you want pain relief? Who's going to be in the room with you?
Yeah.
What concerns do you have about delivery? Because we want to make sure we address them ahead of time. When you're in labor is not the time to have a thoughtful conversation with a patient. So we want to make sure we address it ahead of time and the patient knows that we're there for them.
Yeah. Now, many new moms, we spoke about breastfeeding a little while ago, many new moms struggle with breastfeeding once they get home.
Correct.
Can they call someone after they leave the hospital for help?
Yes, we have many resources for moms. Hospital-based, they have the phone number for postpartum, the postpartum floor, where the lactation consultants are, so they can speak to them at any time. We have appointments for lactation consultants in the clinic after they deliver. The pediatric practice, when you bring your baby back, they also support breastfeeding or any type of feeding that you have, any type of questions. And we connect them with community agencies that have doulas and postpartum support groups there.
Yeah. You know, we forgot to mention your role and your position. You oversee many of the women's health services at Lincoln Hospital. Can you explain what that role entails and the responsibilities you manage in your position?
Overseeing the Department of OBGYN means overseeing all of women's health, not only what happens in my department, but in other departments, in the emergency room, in the operating rooms, in other places in the hospital. That's a lot of what I do. I also love to take care of patients myself. I still go to the clinic, I still deliver babies, I still do surgery in the OR, and I think that's really important because that lets me see what's really going on and lets me connect with patients at a different level. Another thing that I really enjoy about my job is I get to teach. I teach residents, I teach new attendings who come on, who are right out of residency. I get to teach medical students. I get to show them not only the science and the background, but what it feels like to do a really good job taking care of patients in our neighborhood.
Yeah. Any of those mothers come back to show their appreciation and say, hey, doctor, I love you. Thank you so much.
All the time. They see me on the street. They see me in Target. They see me all over the place. And that's really nice that they appreciate that and they recognize you. It's a great feeling. It's lovely. And it's nice to see how the kids grow up. I mean, I used to get Christmas cards every year.
Yeah. What sticks out in your mind? Any one patient or group of people that you work with just wow, this is great. I mean, that's most memorable to you.
I think in our community, when I say the community, I mean the Bronx. We have a lot of patients with a lot of different ethnicities. And as they mature and they get older, the changes that they go through, they're told by their family members, by their friends, you know, get used to it. This is the way it is. This is what happens when you get older. And then you see them in the office, and you ask them about it. And first of all, they're surprised when you ask them. And I say, you know what, I can help you. There are things we can do to minimize the side effects of menopause. And they're amazed. And we have a conversation, we decide on a treatment plan, and they'll come back and they're like, my life has changed. My quality of life is totally different. I was told by my grandmother, my aunt, that just get over it. And you have made such a difference because we know that actually, you know, quality of life is huge. It may not, the symptoms of menopause may not kill you, but it will take a toll on your life. And this is how we can help people.
And discomfort a couple of other people around you too.
Yeah, exactly.
Your family,
your family appreciates it also.
Exactly. Well, listen, thank you. Thank you so much for spending some time. We're going to take a quick break right here, but when we return, we will continue our conversation with you, and we'll have a great time. I mean, I've got great information. You don't want to miss it. It's Dr. Debra Taubel, Chief of OBGYN, and I'm going to say that 5 times with OBGYN, OBGYN
There you go.
services at Lincoln Hospital. Stay tuned. You don't want to miss it.
During the day, relive the Bronxnet originals that sparked conversations and built community. At night, dive into the hip-hop throwbacks that defined a generation. One destination, two powerful lineups. Now playing on Optimum Channel 952, Fios 2138, and streaming at bronxnet.tv. BX Legacy, where history meets the moment.
And welcome back. You're watching Inside Lincoln Hospital, the heart of the Bronx, with Dr. Debra Taubel. She's the Chief of OBGYN Services at Lincoln Hospital. Doctor, we've been sitting here talking, and you're a wealth, like I said before, you're a wealth of information. Let's switch gears, though, and talk about surgery and sensitive issues of concern for women. Health isn't just physical. If a woman is feeling overwhelmed, distressed, or just beside herself, what are some of the things that you can do when she's dealing with those problems?
It's a good question. When a patient comes in for their exams or for their visits with us, we screen them for many different social stressors and psychological stressors. We have social workers in our clinic every session. They are available to speak to the patient. They are available to refer the patient to social services or to social agencies if necessary, to psychiatrists, psychologists for other things. So we actually address these with patients. If they don't want to address it with the doctor or the provider, they can talk to social work, and they're always available. You don't need to even see the doctor for a visit. You can just come in and see the social worker. And we have a lot of resources, both in the hospital and in the neighborhood, for patients to take advantage of.
It seems like the social work is so very important at a hospital.
Incredibly.
You know, because people may be dealing with domestic violence and other
That is correct.
problems in our community. What role does that social worker play above and beyond what they're doing? I know sometimes it's just got to take it to another level.
Exactly.
Yeah.
And besides what we have in-house, we have connections to city social services, we have connections to housing, we have connections to how to get your SNAP benefits and your WIC benefits, et cetera.
Yeah.
All of that can play a part in a person's well-being. If you're constantly stressed about providing for your family, if we can alleviate that a little bit, we've done a really good job.
Yeah.
And again, they don't have to see a doctor. They can come in and just see the social worker and get those services settled. Social work also does a great job of following up with the patients. Once they walk out, it's not like it's closed and we're done. They will bring the patient back in or contact them and say, hey, is everything working out? What do you need from us now?
Yeah.
Because it's really important for, especially women who tend to be the caretakers of the family. They need to make sure that they're being taken care of also.
And sometimes I visit a lot of the soup kitchens, and there are long lines.
Yes,
I mean, more so
more
than
and
ever
more.
before.
Yeah.
So a lot of people have those problems.
Yeah.
Can they be addressed at the hospital also?
Absolutely. We have resources in our financial counseling area to make sure that patients get any benefits that they are due, and to go to certain social agencies to make sure that they get things. And it's not just food, especially new moms. Diapers, pack and plays, strollers, car seats, all of that.
Yeah.
We can help them acquire that so that they're ready to have their baby. And also if they have younger children, what other resources are there out there so that they can get what they need?
And we touched on this before, people going through menopause, but there are older women going through menopause who feel like they're losing control of their bodies.
Yeah.
Does Lincoln provide any services for them?
We do. And we have a certified provider who has been certified by the Menopause Society to provide menopause care, specialty care. The other thing we like to do with our patients is, so much is centered around younger patients and the changes in their life. When you have an older patient come in, you want to talk to them and say, hey, what's changed? Are you now taking care of your parents? Have your kids moved away and that's changed? Are you still with your partner? Is your partner well? Because all of those things also impact care. Even though her health may look okay, what else is going on around her that impacts that? So we make sure to ask about that because sometimes they're very reluctant to tell you that up front, but once you ask, the patients will tell you.
Yeah. And there are a lot of people walking around with problems with their periods and they're not feeling right. And some of them are suffering from fibroids. And they're afraid of a major surgery that keeps them out of work for weeks. And what are some of the options of getting back on their feet faster?
So fibroids are a really common condition. It's estimated that up to 50% of women by age 40 will have fibroids. For many women, they're asymptomatic. They don't cause any problems, and we just find them and we monitor them.
Yeah.
For some women, you have to monitor them because they have severe symptoms. We try first with medical treatment. If the medical treatment fails, then we start talking about surgery. However, we have every modality at Lincoln where we can do minimally invasive surgery. For a lot of these patients, it's not big surgery in the fact that there's no big incisions on your abdomen. Yeah. It is surgery, but we can do it minimally invasive, and you can go home the same day and still have the same good outcome.
Wow, that wasn't always the case.
That is not always the case.
You had to stay in the hospital for a little while.
Correct,
Yeah.
and be out of work for 4 to 6 weeks.
Yeah.
Now you're out a week or two and you feel great and you go back and no more bleeding, no more pain, no more pressure.
Yeah. What can people do to try to avoid fibroids? And what are the symptoms? I mean, what can they do can they eat differently, or is it from food, or?
We like to think there are things like that, but it's usually genetic and usually runs in
genetic.
families. And we see that women whose moms had and sisters have fibroids, they will have fibroids. The easiest thing to do, though, is come for your annual exam so we can check you. And if you have fibroids, even if you don't have symptoms now, we can monitor you every year to make sure they don't become symptomatic and don't become a really severe outcome. And some of it also is based on, whether the woman wants to have a baby or not. The easiest way to treat fibroids is removing the uterus. But if you still want to have a baby, if we catch it early and treat it early, you will still have that opportunity to have a good and healthy pregnancy, even with the fibroids.
And somebody hearing the word fibroids for the first time, what is that? Is it a growth? Explain what it is.
Fibroids are tumors in the uterus. They're not cancer, which is why we don't have to remove every single one of them, but we do have to monitor them. And you can have 1, you could have 3, you could have 10. They tend to grow as you get older, so they get larger. You can have pressure symptoms, you can have pain. Most often women have bleeding. And sometimes the bleeding is just annoying, which is not horrible, but sometimes the bleeding can be severe. And if you have severe bleeding, as you get older, it's harder and harder to recoup.
Is that a part of abnormal periods?
Yeah,
the bleeding?
absolutely.
Yeah. And what's the difference between fibroids and polyps?
Polyps usually don't cause heavy bleeding, they cause intermittent spotting, okay, which is annoying, but not horribly dangerous. Fibroids can cause actual hemorrhage, and fibroids can be life-threatening.
Yeah, I just had to throw that in there. People ask me wherever I go. But women may be wondering how their health history affects their genealogy, gynecological health. And are there any existing conditions with family health history that could impact gynecological health? Including risk for certain cancers or other conditions?
Absolutely. One of the things we do at every annual exam and with new patients is ask about their family history, not only of their parents and their brothers and sisters, but also about their children, because the children may actually have an impact on the patient's health. Things like ovarian cancer, breast cancer, some types of GI cancer. You want to know who's had it in their family and at what age, because that may tend to make you screen earlier or be more invasive with the screening to make sure that your patient doesn't have that condition. Sometimes it's genetic. We send them to the genetic counselor to get genetic testing if we think that that may be impactful on their health. Sometimes it's what your brothers and sisters have. If your brother,
Yeah.
if a young patient comes in and says, look, I'm thinking of getting pregnant, my sister had a really hard time, I start thinking maybe I need to do extra testing because I would like my patient not to have a hard time. Endometriosis tends to run in families. As we mentioned before, fibroids run in families. And in addition to that, you also want to check what your patients are exposed to. Do they smoke? Do they drink alcohol? How often? How long?
Yeah.
Are you exposed to secondhand smoke? Because all of those can also impact your health.
And the types of food they've
Exactly.
been eating over
Yeah,
the years.
absolutely.
Yeah. Wow. Yes. Our community works hard, often multiple jobs. Can a woman get her Pap test, a mammogram, and her blood work done in one single visit?
We are open Mondays through Saturdays and 4 evenings a week. We strive to get everything done at one visit. If the patient comes in and needs these things done, we get them done. So we really want to optimize the patient's time and be very respectful of the patient's time. We know if they make an opportunity to come in, we want to take care of them.
Does AI fit into the picture? Because everybody's talking about it. It's everywhere.
We haven't really explored AI yet, but we know it's going to be coming down the horizon. And there are very good ways of using it in medicine where I think it can really help the patients.
So what is your message to women who have been so overwhelmed taking care of everyone else that she hasn't seen a doctor herself in years?
We see a lot of women who come in
They're caregivers.
a little sheepishly, and they say, look, I haven't seen a doctor since my last kid was born, and my kid's 12 years old. We say, don't be embarrassed. Come in. We want to see you.
Yeah.
Even if you think there's nothing going on, you need a well person exam. You need preventive care. We need to talk to you about what's going on in your body. If you have a problem, earlier is better than later. We can usually take care of the problem without it becoming severe. It's nothing to be embarrassed about. Our doors are open. Please come in. It's hard to take care of your family if you can't take care of yourself first.
Yeah. And I know a lot of people who are afraid to go to the hospital. I said, no, they're going to find something. Oh, well, that's what they do.
Of course,
They're going to examine you and do some research and find out all about you.
Right.
But a lot of people say, no, a lot of the old timers too.
Correct.
You speak to, no, I have my own personal remedies. I'll use that.
We
What do you
work
tell
with our
them?
patients. We find a common ground. Sometimes they're very reluctant to accept the care that we offer. So we sit with them and we want to have a relationship with them. It is a shared decision making. We don't dictate care. We want to talk to our patients and say, look, what are you afraid of? What questions do you have? What can we help you with to understand better? And at some point, you come to a consensus on what they'll accept and what they feel a little bit apprehensive about, and you'll get there. But patients really appreciate that.
Dr. Taubel, I think you're going to have a line outside of the hospital. Where's the young lady that was on Bronxnet? we need to see her. Listen, many of us are doing everything in our mobile phones right now. They got this, they got that, they got TikTok, Instagram, you name it, social media galore. Does Lincoln have a way for patients to manage their appointments or see test results on their phone?
Absolutely. New York Health Hospitals use Epic as their electronic medical record. And Epic has an app that you can download on any phone. That's the patient-based side. You can see your test results. You can message your doctor or provider. You can make appointments. You can actually have visits, telehealth visits on the phone, video visits. And it really helps when patients are busy. We see them in the office, we do a PAP, we do all the testing. I just want to talk to you about your results. You don't have to come in. I'll get you on the phone. It's a real visit. It's an appointment. You know when I'm going to get on the phone with you. And you see me, I see you, we can talk about it. And it works really well. Patients really appreciate that because then they get the follow-up they need without wasting their time.
Knowing which symptoms require prompt medical attention can be life-saving.
It's true.
What symptoms should prompt an immediate visit?
So looking at OB/GYN care, there are 4 things that I think of that need to come in immediately. And 2 are pregnancy related and 2 are not. When you're pregnant, any bleeding in pregnancy, you need to be evaluated immediately. It could be a sign that the baby is in trouble. It could be a sign that you are in trouble. At any weeks of pregnancy, even early or late on, come into the hospital, even to the emergency room, you need to be checked. You don't want to sacrifice your baby's health. You don't want to sacrifice your own health.
Yeah.
Also, any pain in the abdomen in pregnancy or back pain. It could be a sign of labor. Now, if you're late in the pregnancy, it could be labor and you're going to deliver your baby. But if it's before 37 weeks, that's preterm labor. That baby needs to stay inside. We have ways of doing that safely. So any pain in labor, please, any pain in pregnancy, please come in. We really need to evaluate you.
Now, you are great. I mean, you're like, the information that you provide is so very, very special. But why should people come to Lincoln Hospital? They're all going to come to see you.
That's okay.
And then they'll learn about the rest
That's
when they
right.
get there.
My team is great. Lincoln has been in the neighborhood for generations.
Yes.
I grew up in New York City hearing about Lincoln Hospital. We are small enough that we give personalized care. We know everybody, all of the other caregivers. If I send you to a GI doctor, I know them personally because we are a neighborhood community-based hospital. However, because we are supported by H&H and we're considered a trauma hospital, we have all the services there. You don't need to go to Manhattan for state-of-the-art medical care with all the subspecialties. We have it here at Lincoln, and we know you, and we're in the neighborhood, and we can take care of you and your entire family.
Yeah. Just a couple of tips for people who are looking to want to visit Lincoln Hospital for one reason or another.
Lincoln, again, we have amazing primary care doctors there. We have amazing care for your children. Obviously, OBGYN is one of the top programs there. We've been cited for maternity care from U.S. News & World Report. We have special accreditation from the Joint Commission for Advanced Perinatal Care. So we are at the top of our game. And every department works interchangeably with the other. We have really good relationships across the entire spectrum in our hospital. So not only will you get good care, you will get good integrated comprehensive care.
Dr. Debra Taubel, thank you so much.
Thank you. Thanks for having me.
Thank you so much. And thank you for all that you do in our community to help others get what they need out of
I
life.
love my job. I love working with people in the Bronx.
You can tell, though.
Thanks.
It shines. You can tell. Thanks, everyone. Thanks for watching. And remember, you can always watch Inside Lincoln Hospital, the heart of the Bronx, anytime, anywhere on Bronxnet.org and YouTube. And while you're there, be sure to follow Lincoln Hospital and Bronxnet on social media to find out who we'll sit down with next. From Bronxnet's Media and Technology Studios in the South Bronx, I'm the Dr. Bob Lee, and I'm hanging out with Dr. Debra Taubel. And I'll catch you another day, another way. And thank you for tuning in and checking it all out at Lincoln Hospital and Bronxnet. Always remember this: what you are is God's gift to you. What you make of yourself is your gift to God. So choose your choice. Let your choice control the chooser. I'll catch you over 107.5 WBLS. I love you all. Peace.
Go, that's a good catch. Coming go, 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 go. That was a good catch. Go, 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 go. That's a good catch. Go, go. That was a good catch.